Good afternoon, and a very warm welcome to all our participants from Asia, Australasia, and other parts of the world. Thank you for joining this third webinar in the UC Asia series on COVID-19. This is also the second part of our food system resilience topics, the first being held on May 26 that shared the immediate effects of COVID-19 on the food system and responses, lesson learned, and outlook for food system resilience with long-term impacts. Now today we will examine the complex issues of food systems and sustainability, highlighting the urgencies of addressing pathways to achieve the SDG goals, especially SDG 2 to avoid and end hunger and malnutrition, which is further exacerbated by COVID-19. My name is Boon Yi, the Executive Director of ILSI Southeast Asia region based in Singapore, who is the host of this webinar. Jointly and on behalf of my collaborating colleagues from other ILSI Asia entities, we would like to thank our two eminent speakers on today's panel who have taken valuable times from their busy schedule to prepare their presentation and to join us in the discussion. Professor Martin Koh from University Adelaide, Australia, and Mr. Exton Salim, Director of INDOFOOD Sukses Makmur, Tbk, Indonesia. Joining them are three other eminent experts on the panel, Mr. Melvin Chow of Singapore Food Agency, Professor Vish Prakash of Ramai University, India, and Professor Shingan Fan of China Agricultural University. And last but not least, our moderator, Mr. Jeffrey Smith, President of ILSI Southeast Asia region. Now, all of them are well-recognized international and regional experts and leaders who have extensive experience and in-depth knowledge on food supply, food resilience, and working respectively on ensuring food and nutrition safety and security. They will share their insights and perspectives on today's webinar's topics. But before the program starts, let me just give a very brief introduction to ILSI in Asia. Now, for those of you who are not familiar with ILSI, we have shared a short video prior to the start of this event with some logistic messages for you to take note of. You can visit our website to learn more about the organization and the scientific programs of ILSI across the world, where we bring experts together to share and discuss important subjects like today. First established in 1987, ILSI is a global federation of non-profit scientific organizations whose mission is to provide science that improves human health and well-being and safeguard the environment. And over the 40 years, we have grown to a network of 15 entities across the world, 6 of which are in Asia, comprising of ILSI Japan, Korea, Taiwan, India, a focal point in China, and in Southeast Asia region, which covers the grouping of ASEAN as well as Australasia. Globally, for example, in 2019, we hosted over 150 scientific meetings, workshops, some shared as education videos that are downloadable. These are posted through our website, and with over 70 scientific publications and research. These are all efforts made through our global tripartite collaboration among scientists from academia, government, as well as industries. And in Asia, the 6 ILSI entities have worked with close to 70 collaborating institutions and agencies to facilitate 60 over scientific meetings, 23 research projects, and have published about 30 scientific papers. These are achieved through our fostering the important tripartite collaboration and in providing platform to facilitate multi-stakeholders engagement in areas such as nutrition and health, food safety and risk assessment, sustainable food system, and the environment. Our goal is to achieve positive real-world impact in target areas, such as those identified in the UN Sustainable Development Goals. ILSI's entities, including in Asia, have a long history of collaboration and joint activities, some of which are shown here for those conducted in 2019, and we have several ongoing projects and publications. That brings me to this series of webinars, which is part of the ILSI global initiatives, several already held since earlier this year, such as the 2 global webinars on nutrition and immunity in April and May, and several held in the US, Latin America in March. So without further ado, I have the pleasure of reconvening our panel of experts and speakers, all of whom at this webinar have declared no conflict of interest. I'm pleased to present our first speaker, Professor Martin Cole, whom I have known and worked with for close to 20 years. Martin is the head of School of Agriculture, Food and Wine at the University of Adelaide currently, and he's an internationally recognized food scientist and expert in food safety, nutrition, and the translation of science into community and commercial outcome. He is the chair of the steering committee of the high-level panel of experts of food security and nutrition of the United Nations Committee on Food Security. So prior to joining the school in January 2020, Professor Cole has held positions including as director of CSIRO Food and Nutrition and as director of the U.S. National Center of Food Safety and Technology, the largest and most successful center of excellence of the U.S. Food and Drug Administration. So Martin, the floor is yours.
Well, thank you, Bunyi. It really is, as you said, we've worked together for many, many years. It's been an absolute pleasure anytime to work with ILSI. I'm going to share my screen now. And what I'd like to do over the next 25 minutes, okay, is to, I think, share really around the lessons learned from COVID-19 in the context of food system and in the context of food security and the need for transformational change towards long-term sustainability, nutrition, quality, and security. And I think most of what I'm going to cover really is in the context, as you mentioned, with the so most of what I'm going to share today really is from the work that was conducted by the high-level panel of experts. This is the technical group that was set up back in 2009 when we had the major food crisis. Then there was a major reform put in place with the UN food security, and the HLP, the high-level panel of experts, was put together to try and bring the evidence base. So this is a group that provides the science and evidence base and advice into the Food Security Committee, which is the policy translation group, if you like, and then it flows back through national governments. So back in October 2018, we were asked to really put something together which was a global narrative, which in a sense it was to try and take stock of where we were 10 years from the last major food crisis, and also 10 years out towards the Sustainable Development Goals. And so this is what I wanted to do. Just to kind of put the context, the first chair of the committee was actually Swaminathan, the father of the Green Revolution. And he as a lovely phrase, he said really that he was hoping that the HLP really is the emergence, would facilitate the emergence of a coalition of the concern with reference to the elimination of hunger. So that's really what one of the key objectives with HLP was, to really bring together the status. Now, obviously, along the way, we've had the global pandemic of COVID-19. So back in March 19th this year, where the high-level panel of experts was asked at very short notice to really put together an issues paper around COVID-19. So really one of the approaches we took was to look at, I mean, this was back then, of course, I think at the time, back in March, we were talking about 210,000 cases and 5,000 deaths. Obviously, as of yesterday, we're at 16.5 million and 656,000 deaths. I think at the time as well, when the emergence of the pandemic, it was in countries with a rather secure and advanced food system, an advanced health system. And obviously the big concern now is the emergence of the pandemic in areas, particularly areas that were already kind of food insecure. So we now have, 738,000 cases in Africa, 2.4 million cases in Brazil, and 1.5 million in India. So I think, I think I should also say, I think obviously our thoughts go out to all of those people that have been impacted by this terrible epidemic. When we were asked to look at this back in March, I think one of the approaches we took was to compare and contrast it to the food crisis of 2008 and 9. I mean, there's some very big differences. Back in 2009, there was a food shortage. It was an economic issue and a food security issue. Stocks of food was very low. This time around, stocks are quite high compared to then, so probably about twice the levels as we had then. So that's a good thing in terms of coming into this. But this time around, it's been a health emergency, and then obviously the measures that we put in place to counteract that health emergency has had an economic impact, and now we're seeing a food security impact. So as the pandemic has passed around the world, we see disruptions to the demand side. So we're seeing things like panic buying and things like the hoarding. But as it's moved through, we're now seeing where both direct and indirect impacts around to do with the measures put in place for social distancing, etc. So we're now starting to see where there's disruption to things like farm labor, inputs to farming, particularly in a critical time, growing seasons and things like that. So that is now kind of starting to impact on the supply side, and we're starting to see disruptions up and down the supply chain. In terms of food security, we're also, with schools closing, we've lost school in many countries. The school meal program is a very important safety net for kids' nutrition, so we've lost that. And then the big thing, obviously, is the economic impacts. We're seeing, very big impacts on a number of different sectors, whether it's tourism, transport, food service, etc. So, it's the ability of people to pay for foods is really an issue there. And so what we were, and then in terms of disruption in the food supply, we're also seeing now many food production setups being impacted with outbreaks, particularly in high labor intense operations like meatworks. So I think in the US, for example, there's over 180 food processing operations that have been impacted with outbreaks. And around the world, we're seeing particularly meatworks being significantly impacted. What we did through this work was to try and put some very quick recommendations together. And obviously the thing we're concerned about in situations like this are, the most vulnerable. So prioritizing the most vulnerable and affected in terms of the impacts, putting in social protection mechanisms to provide essential assistance, both in short term and long term in terms of livelihoods, and then really put action plans into place around the broader interactions with food security and nutrition, supporting supply chain, so making that an essential industry and trying to avoid disruptions in terms of food movement, particularly across borders and things like that, trying to organize for the movement of farm workers and things like that. Also trying to emphasize, I think that's one thing we're going to see through this pandemic, is the emphasis back on local production food systems or community food systems. We put some guidelines together for food workers involved in food production, and the important thing was to share data and experiences. And then to the Food Security Committee, we said really they need to, given this is potentially the largest impact on food security that we've seen, they need to prioritize their work as well. Now, even before COVID-19, we had a number of trends and challenges that really are challenging food security. So we're seeing urbanization. Back in 1950, we had 30% of people living in cities. I think By 2050, we'll have 66%. We've got, I think, at no other time in our history have we had so many people on the move in terms of migrants through conflicts and things. Over 250 million people are on the move and displaced. We know that trade and international trade in food, is driving, the patterns of eating. So, I think at the moment, 1 in 6 people get their staples from food that's traded internationally. I think by 2050, that'll be half of the people. We've got things like agrobiodiversity. We've got, 75% of the food that we create is from just 12 crops and 5 animal species. And then we've got issues like food safety, where we've got food safety now clearly recognized as having the same sort of health burden in the same order of magnitude as tuberculosis and malaria, 33 million daily adjusted life years. And then obviously biosecurity and infectious diseases like COVID-19, massive disruption. So there's almost a perfect storm around food security. So really, even before COVID-19, we weren't on track to reach the SDG 2, and we've just updated now. The FAO have just updated the status of food security, the so-called SOFI report. I think one thing that's quite important to point out. So, I used to talk about 820 million people chronically undernourished. What they've done in this latest report, they've been flagging for a number of years that the report doesn't take into account China, and so they've now done that, and so they've revised their estimate to 690 million. But the point I want to make is that we're still on the wrong trend of this. So we're still increasing over the last few years. I think it's estimated by 2030 we're going to be up at 840 million people food insecure. The big unknown, obviously, with the global pandemic and global recession, is just how many more millions of people will be put into poverty and will be put into food insecurity. In this report, we're really estimating that between just due to COVID-19, current estimate would be between around 80 to 130 million more people going into undernourished category. So even before COVID-19, we were not on the right course in terms of food security. With COVID-19, this just emphasizes the importance and the urgency of international collaboration in this space. Look, another way of looking at it that I've often used is just in terms of the calorie plot. So, a very simple way of looking at this is, look, in my lifetime, we've doubled the amount of food that's available, but it's come at a big cost to the planet. 7 times the amount of nitrogen, 3 times phosphorus, and twice the amount of water. This time around, we've almost got to do that again, but this time around, we've got to halve the environmental footprint. So this is a massive challenge, I think, moving forward, and really going to take a transformational change. The report is quite robust and challenging. It really sets out the need for transformational, radical change to food systems. We're suggesting we add 2 concepts into the food security agenda. One around agency, so this is the capacity of individuals and groups to make their own decisions about foods. They eat what they produce, how it's processed and distributed, and also, surprise, surprise, sustainability. This is a huge issue now. If we have not got another planet in which to double the amount of food, we've only got the one planet. So sustainability is critical in that. Now, I remember a lot of the discussions around the pillars of food security and all of the debate around that, around the existing pillars. But I think really, if you look at the definition of food security, so all people at all times have physical, social, and economic access to sufficient, safe, and nutritious foods that meets their dietary needs and food preferences for an active and healthy life. So really, I think we're arguing that already those concepts were part of the definition, and I think having those concepts built into the pillars of food security will help us. At the heart of the recommendations of the report, there's 4 main really key policy shifts leading towards a transformational change. The first one is and you know, this is certainly, you know, something I experienced a few years ago going to food security talks. It was all about producing more food, increasing yield, productivity. Well, we've got to shift our focus from not just in terms of increasing productivity, but we've got to really look at a transformational change in food systems as a whole. You know, think of it, we can no longer just keep looking at producing more food when we waste a third of the food that we make. We've got to have a whole of systems approach to that. We need to view food security and nutrition as a sector. We need to move it from a single sectorial issue into a system interconnected with other systems. COVID-19 is a great example here where, you know, the public health agenda is driving one way, but if that creates a food security issue the other way, then so we need, you know, the departments of agriculture to work with the departments of health. And so really, again, not just a systems approach, but in the way that we govern issues around food, we need cross intergovernment departments to be working together. And then we've had, I think, quite a focus on reducing hunger and undernutrition. And, you know, but at the same time, we've got this irony where, you know, we've got many millions of people starving, but we've also got an obesity epidemic. We need to be focusing broader, not just on hunger, but all of the malnutrition in its broader form. So in terms of obesity and health and things like that. And then really, you know, we need also to recognize in different parts of the world, different food systems, different situations. We need to be cognizant that solutions will need to be context specific, and that there'll be a diverse array of solutions to meet the needs. And the report has a whole range of recommendations, so building off of those 4 policy areas. And but underpinning all of that also is some enabling conditions around the need to increase governance, particularly in this world that we live in. Where's the leadership going to come from? We really need to have international collaboration around supply chains and a new look at governance of food security and nutrition. Research is absolutely crucial. I'll go on and finish today with just a few examples of what I'm calling the science of food security. I mean, one of the recommendations we made, just to give you an idea on the, you know, on the radical change that's needed, but also the need to monitor progress against those changes. One of the recommendations is, you know, think about it. If we can model the global climate system, why can't we model the global food system? Why can't we understand where food's being produced, where it's going, what status we're in, where are we wasting food? Imagine if we had that model. We could use it to foresight. We could use it to predict different scenarios and their likely impact at a global level. So that's one of the recommendations. We need an effort, almost like, you know, the human genome effort. We need, you know, we have pieces of this around the world in terms of research, but we need researchers to come together around a unifying agenda here to really develop a global model of the food supply. So just to wrap up on the on the report then, so we're really talking of those 4 policy areas, enabling conditions. We've added agency and sustainability into the pillars of food safety, really against Sustainable Development Goal 2. Now, I think I've got about another five or 7 minutes to go. So I just wanted to now move into, so if you think about the last 10 years, really, if the last 10 years have been about, we've made great improvements in our understanding of food security. But if the last 10 years have really been about, you know, improving our understanding, this next 10 years absolutely has to be a focus on implementation and innovative change. We need to move it from having an understanding, describing the system, into solutions to solve the issue, and we need to be able to monitor that. So this was just one framework I'll just share with you about really, and look, it's a ridiculously simple concept for a very complex situation. So it's just about calories. I know it's more about calories, but really, you know, really looking at 3 things. We need to have a focus not only just on filling the production shortfall, Of course, we still need to do that, but we need to be looking at the demand trajectory, and we also need to do things that avoid losses for the current production level. COVID-19 is a great example of that. So what I'll finish with today is just by taking you through some of these areas. So in the demand trajectory, this is where we look at food waste. The nutrition comes in here, things like balancing livestock component with future diets, the balancing biofuel and food. And then if we look at you know, from a nutrition standpoint, we need to be, you know, planning the future food supply chains around what the health outcome that we want. So we need to, you know, of course we need to continue to promote fresh food and things like that, but we need to make, you know, convenient food, processed food, healthier, more nutrient dense, and we need to use the latest science that we've got in terms of personalization of nutrition, and we need to be taking those health and nutrition signals all the way back to the agronomy side and designing the supply chains of the future to meet the right health outcomes, particularly around micronutrients. Now, just 3 examples from reducing the demand trajectory. This is where some of the food preservation would come in. So the example I've given here is just high pressure technology for extending the shelf life, reducing waste as well, and maintaining the freshness and the nutritional quality of foods, but extending the shelf life. We've got now technologies to be able to take vegetable waste and have a new ingredient business. And the crazy example we used just to get the press interested was, you know, you can even have a serving of veg in your cup of coffee in the morning, broccoli latte. Massive interest in alternative proteins to meat as a more sustainable way. So plant proteins, you're seeing a massive interest and investment through the venture side of things in that one. We still need to have an emphasis on filling the production shortfall. So this is the things like yield, closing yield gaps, improvements, using, you know, the latest digital technology, etc. Just 3 examples from here. Plant phenomics, we have amazing science now to be able to measure, you know, the impacts of breeding programs. We've got digital agriculture, we need to bring that to bear. Things like smart fertilizers, even new breeding technologies to have new production systems. I've used oil here as an example. And finally, avoiding losses from the current production level. So this is, you know, about the pest and disease resistance, the soil and water degradation, adapting to climate change, and then also, you know, kind of particularly COVID-19 as an example here. I've just given 3 examples: food safety, whole genome sequencing. We have work looking at the genes related to salinity resistance in wheat and things like that. Can we breed that into our wheat population? And then biological control. So just to finish today, I've just got a couple of minutes just to finish. Just to bring it back really to the importance of what I've been trying to say here, that the right to food really is a fundamental human right. It's inseparable from social justice. And I would argue that feeding one's people is one of the primary objectives of any government and is part of national sovereignty. If you look at the complexity and the interconnected nature of food and nutrition and security issues and their impacts on public and planetary health, these impacts know no borders. If we have a changing climate, there's only one planet that impacts everybody. COVID-19 is another example that's impacted everybody. So therefore, this really reinforces the importance of international coordination. And I would say not only to ensure the future health of the global food system, but also for individual national governments to fulfill their own sovereign responsibility to feed its people. And just to close by saying, really, you know, this is a terrible thing we're going through, but it serves, the COVID-19 pandemic really has served as a timely reminder of just how fragile our global food system is, and the importance and the urgency of the work that we do to foster international collaboration around a global strategic framework for food security and nutrition to end hunger. So with that, thank you very much.
Yeah, thank you, Martin, for a very enlightening and also very thought-provoking presentation to share some of the key points from the report. And I think that the system nutrition change, the prioritizing of how food system works on a global level, And you mentioned about governance, leaderships, as well as the science and food security. I think these are all great ideas that I think to go into transformation and implementation, it requires the collaboration of such a wide, stakeholders group, as well as look into the different cultural and social contexts. So I think this will be really good for the discussion. Thank you. So I would like to bring our next speaker, Mr. Exton Salim, to share with us some of his take on industry responses, and also, of course, looking at to how the food industry, as well as the nutrition community and food supply chain issue, can be addressed. And Mr. Salim is from PT Indofood Sukses Makmur. He's the director of this leading Indonesian food company, and with operation, I think we all do not need to go into detail. Indofood is one of the most recognized food company in the region and possibly in the world. And he also heads many of the business as director of different unit group of Indofood. But more importantly, I think Mr. Salim is really a practicing flag bearer of nutrition, and from the industry, to look into how industry can play a big role in nutrition security, as he co-chaired the Scaling Up of Nutrition Business Advisory Group since 2014, and has served as the GAIN Global Alliance for Improved Nutrition Council member since 2012 to 2014. So without further ado, Mr. Salim, over to you.
Yep. Thank you very much for the lovely introduction. So so thank you so much, ILSI, for ILSI, Jove, and Bunyi, for the invitation, and I'm really humbled to be able to speak in this webinar. Sorry. Alongside Martin, who has given a comprehensive understanding of the food systems, and amongst all the other professors as well. So I hope I will be able to share with you a different perspective. So next slide, please. So this is a photo that was going rather viral in group chats and like social media in March. And in a few days, that was a few days before the government announced the social distancing measures and rumors already started to circulate. Soon people were stocking up on the basic necessities, and we started seeing empty shelves everywhere in social media and the news. And people were starting to panic buy, as in around the region as well. So this was the time when we started understanding food accessibility is a form of security in times of crisis and pandemic. So the first reaction to the food as a food industry is make sure there's enough food on the shelves, or else there will be uneasiness amongst the people, and it may result in social unrest. And just a fun fact though, this photo, the guy in this photo is actually buying his weekly trip. It's a weekly trip buying for his store. So it's nothing to do with the pandemic. And we shall not dwell, I think this is not the forum to dwell on the power of fake news. Next slide, please. So jokes aside, I think there's two factors that come to mind. How do we maintain a constant flow of food products to the market? And how do we actually keep our workers in the food production and supply chain healthy and safe? So how do we emphasize the culture of hand washing, personal hygiene, personal wellness, and of course the social distancing within the workspace and at home? So the basic food safety measures, the good hygiene practices, and good manufacturing practices are now necessities. And we are challenged to review all general protocols and procedures for drivers, delivery staff, visitors, and even workers coming in and out from our workplace, to review to make sure that the COVID-19 does not enter the premises. And this is important in ensuring the safety and also the safety of our colleagues, and to prevent the spread of the disease. And I truly believe that this will be a trend that would be expected from the consumers post-COVID as well. Next slide, please. So manufacturing is only a small part of the complex network, as Martin mentioned earlier. It involves a lot of people activities, getting food from farm all the way to our plate. And the food system includes everyone, everything that's growing, supplying, producing, transporting, and even eventually eating the food. So it involves factors such as food supply chains, food environments, individual factors, consumer behaviors, external influences, and to add a complexity to that, climate changes, globalization and trade, urbanization, politics, and geography. And of course, the food system is also broken down to the food security and the nutrition security side. The immediate problem that we saw and challenges of social distancing would be mobility. Transportation bottlenecks, perishables like fruits, vegetables, eggs, fish, in a timely manner started to happen. And this has led to accessibility issues for individuals and corporates alike. Next slide, please. Technology has played an important role in the lives of Indonesia in the past few years. And of course, 140 million people have access to the internet, like especially among the youth and adults because of the rising popularity of social media. And it is proving to be beneficial for people being asked to social distance. Buying groceries via online, e-commerce, and also the online transportation services are starting to be the norm as people are afraid of going to the wet markets and going out to the supermarkets and the mini markets. So technology has also allowed for a lot of people who used to be unbanked to be bankable in the digital population. Although the buying groceries right now online only accounts for 5% of the total FMCG buy, there is a growth surge of 30% since the pandemic. So there are new solutions as well, not only for e-commerce, but new solutions such as companies like Rogo Pantas, who are linking the farmers straight to the consumers using app-based and allowing the farmers to sell directly, delivering farm-to-plate concept and bypassing the middleman, and of course the farmers get to enjoy more of the margins. So in Indonesia, we have to remember that we're an archipelago as well, and thousands of islands, regional autonomy, and this has created differences in speed for infrastructure, difference in speed for infrastructure development. Take connectivity of the internet, for example. It varies all the way from 4G to 4G in metropolitan areas like Jakarta, all the way to 2G in outer islands like the Papua. So this is where we start seeing discrepancies for the treatment of accessibility for food, food accessibility, food availability, and between the urban and rural, and also between social classes as well. So next slide, please. When discussing about the food system, we also have to include nutrition security. According to the Lancet report a couple of days ago, the COVID-19 pandemic will undermine a lot of nutrition across the world, and in particularly the low-income and middle-income countries. New estimates suggest that without a timely action, the global prevalence of child wasting could rise about 14.3%. And pre-COVID itself, we already have 47 million children under 5 who are affected by wasting globally. So this would translate to an additional 6.7 million children with wasting during the first 12 months of the pandemic. We are definitely not in a health crisis or an economic crisis alone. We are in an economic crisis because of a health crisis. Never in our lifetime have we experienced such a problem. And amongst the uncertainty, we have no prior experience to this and no cheat sheet to copy from, and hence the trial and error methods that has been taken or used by the various governments. So it's not only that, I think most countries are also being forced to play tug of war, either to prioritize health or the economy. So, and in Indonesia, it's no different as well. So today, I will try to dissect factors from the COVID-19 pandemic that has impacted and created challenges for the food system to maintain its sustainability. And I'll be using Indonesian figures to illustrate and also touch on the nutrition front. Next slide, please. So, hello, next slide, please. Yeah. So social distancing measures will continue to affect various industries in Indonesia, particularly the agriculture, automotive, manufacturing, accommodation, F&B, all mostly will be impacted, as they comprise 45% of the country's workers, according to 2019 numbers. In the beginning of the pandemic, the Ministry of Finance states that there is a risk of 2.9 million people to 5.2 million people who could lose their jobs through the period of the pandemic. But as of May 2020, about 375,000 formal workers were laid off, and about 1,032,000 formal workers had already been asked to stay home, either unpaid or half paid. Just a quick snapshot as well. Indonesia's minimum wage of formal workers range about $170 to $280 a month, of which 49% of the wage will be spent on food. Informal workers will be earning much less than that, and the percentage that they will spend on food is about 65%. So with that, the reduction of household income or the purchasing power due to the economic impact of the pandemic, coupled with the supply chain disruption, may push households to sacrifice the quality and quantity of their food consumption, further increasing the food and nutrition insecurity. Next slide, please. So even though we have food balance remains safe, for most of the majority commodities, Indonesia is dependent on imports to meet domestic demands for several of the commodities, such as wheat, garlic, soybean, and sugar. Exporting countries like Vietnam, Thailand, USA, Brazil were prioritizing their domestic needs of staple foods such as rice, wheat, and corn. And a quick snapshot of these main commodities such as wheat, corn, and rice, there's an increase of 5 to 20%, while the commodities such as shallot, sugar, and increase up to about 30% in the beginning of the pandemic. And the price difference is depending on the difference of area in our archipelago. And so with that, the government had to step in and put in place several policies and interventions related to trade, logistics, and agriculture. The Ministry of Trade issues the relaxation of imports for horticulture commodities such as garlic and onions, and the President issued the presidential regulation to simplify import licensing during the pandemic, and with that, the prices of the raw materials has since stabilized. The government of Indonesia also had to expand the coverage of the existing social project, the social protection programs, and also come up with new schemes in response to the COVID-19. And the negative effects of the rise of unemployment are more likely to impact the poor and vulnerable groups because they have less resources to absorb and adopt. The government of Indonesia has also allocated 405 trillion rupiah, which equates to 27 billion, for response measures, and also 110 trillion Indonesian rupiah, which translates to 7. The government financial and social assistance to the vulnerable groups have been crucial to help to mitigate an impact of COVID-19, and it comes in shape of distribution of finances and also necessities such as rice, cooking oil, and protein. Next slide, please. Not much data has been collected not much nutrition data has been collected in Indonesia since the pandemic. But prior to COVID, we are already plagued with a lot of malnutrition problems. 7.7%. I'm missing the points. Sorry. 7.7% of Indonesia did not have enough caloric intake to meet their daily requirement. 5.4% of households were moderately or severely food insecure. 95% of Indonesians do not consume enough sufficient fruits and vegetables intake, and all this is done from the research Riscus does 2018. And in terms of nutritional status, 27.7% of under 5 children were reported to under stunted growth, while 16.3% were underweight. 7.4% experienced wasting in 2019, according to Riskersdas. And let's put it into context. If we have 5 million children being born in Indonesia yearly, that's 1.5 million children who are at risk of suffering from being stunted. And not only that, Riskersdas also states that 48.9% of pregnant women are suffering from anemia in 2018. And the COVID pandemic will backtrack the already ambitious targets that the government has set of 19% stunting and 7% wasting and anemia in 2024. Next slide, please. So as I've been fortunate enough to be involved in the Scaling Up Nutrition Network through Scaling Up Nutrition Business Network, which I currently co-chair. I'm co-chairing the Global Advisory Board. The Business Network also helped to mobilize businesses to support country-led Sun movement, and the Sun Business Network aims to increase availability and affordability of safe, nutritious food everywhere. And globally, we have over 600 SBN members, member networks, and including SMEs, 22 global members, 12 country networks, and 9 emerging country networks. In Indonesia, I think we are the only one that is coordinated and led by private sector, while the other countries are being incubated by Global Alliance for Improved Nutrition Gain, or the World Food Program, the WFP. So in Indonesia, we have 25 companies with us supporting the government's priorities, and with 3 priorities: 1,000 days and adolescence, balanced nutrition, and sanitation and hygiene. And we have grouped the activities to 2 categories: intervention and prevention. Intervention is needed in helping to solve current problems in a very timely manner, such as fortification and providing access to nutritious foods and children and workforce nutrition. While prevention is needed to help us to achieve our long-term goals, which focus on education, behavior change, and targeting youth, is definitely key. Next slide, please. Very basic intervention is food fortification. I think producers support government on staple food fortification. INDOFOOD Bogasari was the first company to initiate a voluntary fortification of wheat flour in 1998 to support the government's program to reduce micronutrient deficiency and fortify our wheat with iron, zinc, folic acid, and also vitamins. The program has become mandatory in 2003, and since cumulatively, we have fortified over 50 million metric tons of wheat flour since. And also for cooking oil manufacturers, such as our brand Bimoli, are mandated to fortify the oil with vitamin A. So despite the relaxation of government regulations on fortification during the pandemic, the companies are still fortifying and maintaining a stability on pricing. Next slide, please. For intervention, we need to look at it from various different angles. So the first one that I'm going to share is workforce nutrition, which is a program initiated by the Scaling Up Nutrition Business Network for its members. It is a health improvement program, including healthy diets, lifestyle, physical activities at the workplace, and such as offices and factories, with companies like NutriFood and Panasonic leading the best practice method by providing healthier food at the work, nutrition education, and breastfeeding support. We do pre-study of our pilot workforce, study the baseline of health, fitness, and hemoglobin level, and we do a post-study after the of the intervention to see the health benefit, and also if there's any kind of behavior change that is implemented in the workplace and as well as home with their families at home. So these studies are done together with University of Indonesia Public Health and also the Bogor Agriculture Institute, and we'll be benchmarking it together with the ILSI Japan and also the NJPP for the results. Currently, we have pledged, we have 100,000 employees pledged, and all from within our network, and also implemented already to 25,000 workers. Next slide, please. I would like to share with you another behavior change project with an ongoing intervention called POSYANDU MANDIRI on how government, academia, and private sector can work together. Posyandus are health centers which has the potential to reach at community level. But these centers are run by volunteers who most of the time do not have the knowledge and education to educate the communities on health issues. So Posyandu Mandiri translates to independent Posyandus. In the outskirts of Jakarta, INDOFOOD Bogasari has adopted 54 Posyandus, and together with University of Indonesia Public Health faculty, implemented the Posyandus Mandiri since 2016. And so far, we've served 8,000 children under 5 and 290 mothers. So how does this work? We'll start off with training 20 master trainers and disseminating them to 250 Posyandu volunteers. They will be educated on Posyandu management, the operation management, nutrition knowledge such as 1,000 days, anthropometry, balanced nutrition, communication, and motivation as well. And since Posyandus are disconnected to the official line of Ministry of Health, we created an economic model so that the Posyandus can be financially independent by teaching them how to create cakes, breads, snacks to sell. And this is supported by our Bogasari baking centers. And we managed to make it into a gathering place to support mothers and children's health, and a place to disseminate proper health and nutrition information. And we are very proud to say that since 2016, we are seeing at least 30% of a reduction of undernutrition cases in the Posyandus that we intervene. Next slide, please. So one of the main causes of a high stunting rate in Indonesia is definitely anemia amongst women, and starting from adolescents. So in order for us to have a long-term solution, education is definitely key. And educating the adolescent girls is a good way to prepare them to be future mothers by helping them to understand the prevention and habits and nutrition. So youth and digital. I think what better way to using something like that, something that they are most familiar with, to reach out to them. Right? We believe the online and digital platform is the fastest way to reach our adolescents target market. So in 2018, I was introduced to Ruang Guru, an education platform startup, who at that point already had 8 million children within the active users within the network, and all the way from grade school to high school. So together with University of Indonesia Public Health again, we created a free module called Hidup Sehat Yuk, which translates to Let's Live Healthy modules. We created 40 modules with short videos on various topics, from balanced meals, anemia, understanding what 1,000 days is. And we recently also added new modules to teach you the do's and don'ts of what COVID and the information around COVID. The beauty about this is that after watching it, they have to go through a series of pop quizzes so that we know that they understand the main concepts of these videos. The digital platform, we can monitor the usage, response, and the understanding of its active users. And also we can improve the content of the 40 short videos accordingly. And by June of this year, of 2020, there is already 600,000 users of grade 8 to 10 who have access and finished the course of courses in the Hidup Sehat Yuk module. So just to end and have a wrap up, it's that next slide, please. Yeah, so with that, something that the COVID-19 pandemic has taught us is that technology is something that we can learn to rely on for mobility and innovative solutions. But we cannot forget that not everyone has access to it. We must remember that there are problems like malnutrition that will there pre-COVID-19 and are still there and will still be there and probably need more urgent solutions to solve. The importance of country being self-sufficient is also very important. So the food system is already a very complex system. Add a layer of outside forces, and now with the COVID-19 pandemic issues, there cannot be a one-size-fits-all solution. We need all the players from the value chain working on various solutions and stringing them into a cohesive solution, cohesive picture. Thank you very much. I hope that gives a new perspective of or a complementary perspective from Martin's presentation. Thank you.
Thank you. Thank you, Exton. This is really marvelous. I think a lot of the initiative from the private sectors is what we need, and especially those that really look at nutrition, food safety as one of the priorities in the business model. And I'm very, very heartened to see that Bukasari is still doing this fortification, because you know, in the early 2000 and end of 1990s, ILSI was really heavily involved with the EDB, in the fortification project on initiating the project idea, the iron deficiency elimination action for the Asian countries. And I'm glad that you are also working with our ILSI Japan Center for Health Promotion project on, workplace nutrition. Definitely, I think that this is really a partnership between academic, scientists, as well as industry to try to address this complex issue. But of course, like what Martin has indicated, that we really need to look into some research to make sure that the data are there to be convincing, and also to make sure that the implementation can be carried out effectively. So thank you very much, and we look forward to further collaboration. So I'm going to pass over to Jeff for the panel, and I'm going to ask the panel to join us. In addition to Martin and Mr. Exton Saleh, we have three very eminent panelists who just joined us, and I think that they have such broad and different perspective that can be shared and address this whole complex issue. So Melvin Chow, Prakash, and Shengen Fan. And Jeff, over to you to such a extinguished panel and for you to facilitate the discussion. Thank you. Thank you, everybody. Yeah.
Okay, thank you, Bunyi. Thank you to our very fine speakers. Really interesting, detailed information on the challenge that we face and some of the ways forward. We're looking forward to good discussion with the additional panelists. Let me first introduce the three panelists. You have the information in your registration, but just to say very quickly, Dr. Vish Prakash, professor at my university in India. He's also the vice president of the International Union of Nutrition Societies, and was formerly the director of the Central Food Technological Research Institute in India, the leading research institute in food technology, and he's a fellow of the Institute of Food Technologists. Next panelist I'd like to introduce Dr. Shengen Fan, who's chair professor at the Chinese Agricultural University. He joined them earlier this year after having served as Director General for the International Food Policy Research Institute, based in Washington, D.C. He's a globally recognized expert in agriculture and food systems development, and serves on the World Food Prize Advisors, and is a fellow of the American Applied Economic Association. And finally, Mr. Melvin Chow, which was the Singapore Food Agency, which is an agency that looks after food issues in Singapore. He serves as the Senior Director of the Food Supply Resilience Division and the Food Infrastructure and Development Management Division of the SFA, Singapore Food Agency in Singapore, which only formed last year, but it was a bringing together of all the food activities. So he was working in food capacity with the predecessor organization for a number of years before that. And so in that role, he works on and has responsibility for the food supply strategies. So as you've just heard Mr. Salim say, having local sourcing can be important, but in Singapore, that's pretty difficult. We're a pretty small country, so not a lot of room to grow on food, but Mr. Chow is working on that, so you'll hear a bit more about that. And he also works on how to manage increased agricultural development in Singapore and resilience. So with that brief introduction, let me give each of the three new panelists just a few minutes to say some words, either in inspired reaction to the speakers or a little bit about their own work. Perhaps starting with Professor Prakash.
Thank you, Jeff, for that very good introduction for all the speakers. And in doing so, I would probably make 5 important points, and we can take up more points in discussion. I think when we look at food systems, basically, the food chain and the farm to consumer, what strikes to us very importantly, the safe food, as well as the differentiation between the sectors of food in the market, as well as handling of the chain, which has become very different in a new style now. And of course, Salim mentioned about nutrition, but most importantly, the farmer must be encouraged to grow in this very peculiar situation and not stop at any point of time. But at the same time, we must realize that without industry, any food cannot reach the consumer. So therefore, it is vital that the public, private, and the farmer and the consumer are all in one group. But the word resilience is an interesting word that has been put here. And in fact, 2019 has been the year of resilience, basically. And in here, we require a lot of mid-course correction in our food system, the post-COVID preparedness that we require, as well as the flexibility, adaptability, and also to personalize many of the foods, and including the spices and condiments on the one side, and the reliability, and also the affordability, accessibility becomes very vital. Sustainably, the food business has to continue much more vigorously than what it was, because these are the times when there are difficulties. But in spite of that, the many farmer cooperatives around the world has really done marvelously well, especially in India. If I take it as an example, milk is #1 for the last 15 years in its production, today reaching 186 million tons. And so for feeding 1.35 billion people, 186 million tons of milk is self-produced, and that is within a radius of 30 kilometers. That brings in the point of impact and learning. What do we learn from this? The role of localization, provided there is sufficient land, there is sufficient labor, there is sufficient system of resources, becomes a very important policy, so that the movement is not being majorly dependent upon. My last point is, there are certain things in the material, food material, that requires value addition. So the fundamental point is the primary processing, which India has done marvelously well, and at the same time, using that primary processing to make it semi-processed, so that people can go back and finish it in the kitchen, and if there is no kitchen in the restaurant. So there are 2 sections of population. One who go and cook in the kitchen. The other one would be just given a meal in terms of ready meal. So both the models have to work together in order to combat. In conclusion, I would say the future portion of the pandemic is yet to come. And we are really looking forward for better news of vaccine. But till now in vaccine, we are very lucky that COVID is not foodborne. If it was foodborne, then we would have been a lot of problem faced. But you never know. COVID is very notorious. It is mutating every day. And who knows what is there tomorrow. And if it becomes foodborne, then we have to be ready in terms of handling it, both in small, medium, village, cottage, women industries at the local level, with high nutrition, with high quantity of food that is required to supplement the staples, as well as nutri-grains, and the forgotten many of the things. I would conclude, so therefore, globally, we need to be careful in addressing. And as President-elect of IUFOST, I have one message, that we need to really look at immunity as a tool for our system. until the entire system is ready, we need to take care of food. And I think in here, the various models that IUFOS has brought in terms of SIPs, in terms of many other areas of work like summits and also global meets, have really made a big difference in networking the networks. And how do we do that with all organizations together? And that's very important in today's pandemic. If we can do that, we will be almost disproving the United Nations report that there is a scare that hunger and malnutrition will not end in 2030. So let us disprove it together, that it is possible to have it done to the best available material, men and focus and women for the 2030 in terms of SDG 2. I think we are capable of it. And let us be dangerously optimistic and confidently optimistic that we can do. Thank you very much.
Okay, thank you, Dr. Prakash. Very inspiring words. And yes, I left out the incoming president of the International Union of Food Technologists Society. So that's very important on those points. And Mr. Chow, please, floor is yours.
Hi, thank you, Jeff. I'm actually very humbled by the very distinguished speakers in the panel. What I'll do is basically share a bit about what Singapore does in terms of food security. Food security is really an existential issue for Singapore, just like water. And this is one of the reasons why the Singapore Food Agency was formed. Like what Jeff said, we are 1 year old. And essentially the purpose is really to focus on food security, both supply as well as safety. But that being said, Singapore has been securing its food supply through 3 strategies. And particularly, I will focus on the local production strategy, which I will elaborate a bit more on. There are 5 work streams in that strategy. So, but essentially, at the moment now, I think import diversification is one of our strategies, the second being grow local, and the third being grow overseas. Import diversification helps us to reduce our reliance on any one supply source, and grow local is to really look to mitigate our reliance on these imports and to serve as a buffer during supply disruptions to import sources. And grow overseas is really to support companies to expand and go overseas so that their produce can be exported back. While import source diversification has worked wonderfully well for us, with over 90% of our food being imported, we are vulnerable to food supply disruptions brought about by external factors, disease, climate change, global pandemics like COVID. And this is why we are paying particular attention on local production. That said, the 30 by 30 goal was set up before COVID took place. It was actually started last year. And we must say that it's an ambitious goal to meet 30% of our nutritional needs by 2030. And currently, we are just really less than 10%. So I mentioned about the 5 work streams with regard to the 30 by 30 grow local. These are basically in the area of space and infrastructure. Jeff has quite rightly pointed out, Singapore is a very small place. We have very limited land, and which is why the space and infrastructure piece will be an important piece that we have to look into. Singapore is almost like a city in any of the countries like where Prof. Prakash is coming from. So that's why there's a fair bit of focus there. The second piece, it's basically in the area of regulatory reviews. Singapore hasn't actually been very focused on agriculture, but given that we are looking at agriculture in a very different way, we view that the regulatory aspects of how agriculture is going to be done will have to be reviewed. And that's where the government agencies are coming together to look at it in order to basically be more pro-enterprise and support the development. Of course, the third work stream is in the research, innovation, and enterprise. This is an important piece because given our limited space and land, the research and innovation will be a very important piece in order for us to be growing more with less using technology. So a 144 million research fund has been rolled out and to look at sustainable urban food solutions and future foods, advanced biotech-based protein production. The fourth work stream will be in the industry partnership. I think was quite rightly pointed out by Prof. Prakash as well. The role of the industry cannot be basically neglected. So there's an enabling schemes, as well as developing a pipeline of workforce, because Singapore is not traditionally an agriculture country. Hence, developing this workforce and the expertise is important. And finally, the branding and promotion of the produce, because essentially a demand is needed in order for the local produce to be able to be sold. So I will just touch a bit more details into the land and the space and infrastructure piece. Essentially, it's really to avail more space, land, as well as space for the purposes of such industry. As a small country with limited land and sea space, we have many competing needs when it comes to land. In fact, less than 1% of our land is available for agriculture today. And hence, since 2017, we have actually played a very proactive role to avail more land for agriculture companies with promising technologies. We are also developing the Agri-Food Innovation Park, a high-tech agri-food cluster in Singapore. It will be the nucleus of Singapore's high-tech farming industry, co-locating agri-food R&D, production of inputs to agriculture, food production, and shared facilities. It will demonstrate new innovations in agri-food technologies that can be scaled up in the other farmlands that we are going to be availing. Over and above that, some of you may have heard that we have also unlocked some alternative spaces locally. I think in May, we went out to launch some tenders for rooftop spaces in a handful of public housing multi-story car parks for urban farming. Such spaces, in essence, is to add the benefit of bringing agriculture closer to the public, and in essence, to allow them to better appreciate the process behind bringing food from farm to fork. So that is one aspect of which I thought I will share a bit more. And in closing, I just want to share that it is an ambitious goal, especially for a country like Singapore. But with strong determination and with close partnerships with the various stakeholders, I am optimistic that we can do it. Yeah. Thank you, Jeff.
Okay, thank you all. Thank you very much. We lost Dr. Prakash for a moment. It looks like he is on his way back. So great. So let's just dive right into discussion. And so I start the first question. I think somebody we all can relate. There was some mention of price spikes, and maybe Professor Cole, you said this crisis has been a little bit different than 2008. The price spikes in general have been less. And I think you indicated one reason was stocks were higher, but generally we think of high stocks is not very efficient. So I don't know if you have any more details on that. And then I've been interested in Mr. Salim's, business experience, without giving away business secrets, but usually businesses try to keep their stocks low. So how did you find that? Was there information flow that was different? You pointed out in Indonesia, sugar prices were up, surprisingly, because Indonesia is the big producer of sugar. Professor Fan is economist, may have some. I know he's done some global work on that. So maybe start with Professor Cole. Maybe you can comment on that aspect. The relative.
Thanks, Jeff. You okay? Yeah, I think so. I think what we're seeing is both softness in some prices. So we're seeing, collapse of food service industries and things like that. So we're seeing, wastage, food going to waste. It's in the wrong packaging for retail and things like that. We're seeing, so you're starting to see some disruption. We're seeing some softness in some categories. I think as you start to see some countries, as was mentioned with some of the other speakers, as we start to see some countries now starting to really take a protectionist view and really, kind of think about their own population, that's when you start then to interrupt a global trade in food, and that's when you start to get price volatility and price hikes and things. So I don't think we really know how far this one's going to go. The big difference with last time round was that particularly for staples, the stocks are high, but I think the issue is more around particularly perishables, fresh produce, seafood, particularly with the collapse of things like the restaurant business and tourism. You're seeing kind of disruptions to the supply chain. So I think we're both, I think we're all kind of looking at this in terms of, despite the fact stocks of staples are high, we don't really know the depth and the longevity of a global recession. Now that's really what we're concerned about, particularly, you know, in countries that may already have food insecurity. Thanks, Jeff.
Okay, thank you. Yes, it's important to remember we're still in the midst of the crisis. So we're not over. We can't say exactly what's going to happen. Mr. Salim, some comments on what mitigated those price spikes or caused them in some cases? Better information. I mean, now everywhere in the world, even all over Asia, all over Africa, people have mobile phones. They can communicate the prices. They can communicate supplies. Does that help? Is that a factor?
I think one of the factors that was affecting the whole price spike in the beginning of the pandemic was, one is probably the information was it's not really the information flow, but it's more on okay, but let's put it this way. I think nearly 100% of our garlic use is actually imported from one country only, that's China. And during the whole COVID, the beginning of the COVID, I think there was a reluctance of Indonesian government wanting to import, because one is the whole COVID situation, you know, the stigma behind it. So with that, I think the solution to that was actually the diversifying of the different countries. So now, as a company, we don't only source from one country, but we do source from the different countries as well. So that does help with it. In terms of information flow, I think within the whole industry, we do understand. We do talk to each other, you know, seeing what is the stock level within the country. So on that front, I think technology does help in the price point. But diversifying of the sources, I think, does help as well in stabilizing the price points.
Okay. Thank you. Professor Fan, any global comments on the price impact? It's kind of a signaling mechanism.
Yeah, for 2007, 2008, food prices went up for a couple of reasons. One was higher oil price. Second is export bans, together with the droughts, triggered by the droughts in Australia, Argentina. But this round, oil price is not high. That's why you have not seen very high price spikes for stable food. So that's one. Second, on export bans, in March, maybe April, some countries were planning or threatened to use export bans to secure their own food supplies. But the global pressure from FAO, from the World Bank, from G20 do not ban the food exports. I think to some extent that worked. For example, Vietnam, Egypt, Russia, Ukraine stopped export bans. I think that was a good collective work, global pressure. So stable food price has been very stable margin. We have good production from last year, and it was good harvest during summer crop here in China and so on. But I want to emphasize the price volatility of fruits and vegetables. But this round, the price volatility of vegetables is much higher. It's not the global level. It's very much the regional phenomenon. You cannot just use a global average. You don't see the regional variation. As you know, if the poor people do not have access to vegetables, fruits, or some animal source proteins, their nutrition, their health will become. Let's pay attention to the price volatility of vegetables, non-stable foods. Thank you.
Yes, thank you. Yeah, you point out a very important point also on cold chain. So sometimes, particularly in Asia, the cold chain for distributing fruits and vegetables is not always so well developed, and some parts of Asia can be pretty hot. So that can have an impact on the availability and preservation. That's very helpful. Dr. Prakash, you like to say something on that regarding India or pricing impacts? Or
yeah, I think it's very important to realize some models which I already mentioned about the 30 to 40 kilometer radius self-reliability of perishables. So in this model, when the supermarkets are closed, when the big markets are closed, where will the farmer really find buyers? So it is these old concepts of village shanties that works in a very, very efficient way with, of course, physical distancing and mask, etc. Worked out brilliantly well in terms of perishables. But as regards the staples, we need to really thank Professor Swaminathan for the self-evergreen revolution that has taken place. Luckily, India does not have to import anything, but that is not the case with many countries. But at the same time, we can't just close our eyes for wheat, paddy, and maize, because the food is made up of 100 different ingredients. So all of them have to be available. Just give me 20 kilograms of rice and say this is what. So I think it is very important that it has to be a holistic approach. Even if one or two spices are missing, then the food is not consumable at that point. So I think it is a holistic approach of 5 different sectors to be reaching the kitchen at the same time is a very, very important logistic phenomena. And that impact has to be evaluated quantitatively, how it really matters. So in that connection, I want to make one point before I close. It is vital that even one ingredient, if it is missing, many a times there are problems of a different kind altogether. So I think it is vital that how do we, from a digital angle, make the availability to the consumer at that point of most of them, not the luxury items, but the basic items that go into a pre-ready food that it can be put in the kitchen and made. And I think that's a very big challenge for the future, and we need to do. One has to see my report on HLP, on food losses and waste, HLP report number 8 with the team leader, I remember. So in this condition of COVID, we must all learn how to minimize the waste, how to use every part of a vegetable and not throw anything. So this makes a lot of difference to get more from less for more. And that is very important, the impact analysis. Thank you.
Okay, thank you. I'm going to, if I may, skip Singapore. We complain about prices, but basically I'm going to skip that part. Let's move into, so this COVID crisis has emerged in the face of a long-term issue. So Professor Cole mentioned about trying to reduce hunger. There's a lot of discussion about improved diets globally, obesity also being an issue, and trying to gain better health. We now recognize we want to improve immunity. One of the aspects that's been recommended for that is to look at biodiversity. So we always say almost 60% of the world's calories are coming from basically 3 crops, from rice, commonly in Asia, wheat, and maize. And yet in just for example, but also in many other parts of the world, there's a wide variety of additional plants that are available, and as well as additional fruits and vegetables. What steps could be taken to maybe get a perspective first from the industry side? What could encourage industry to look at some in Indonesia? There are hundreds of plants which are edible and even traditionally eaten, but not yet widely known around the world, or not a big percentage of the food supply. How do you look at that in terms of introducing new foods from the region?
I'm assuming that I got cut off a little. I'm assuming that question's for me.
Yes, sorry, Mr. Salim.
So I think in terms of introducing new foods to the local market in Indonesia, a lot of the influences has been from outside in. Like for example, for dairy, I think dairy we've had introduction since the early 1900s by the Australians. Wheat, I think wheat and the milling, I think it's definitely not our kind of food products. But right now, I think what I'm starting to see is there's a lot of interest in the beans product, like soybeans, the tempehs, the turmerics, which is getting exported a lot to the different countries as well. So I think we are starting to see the health benefits from it. I mean, turmeric itself has the anti-inflammatory properties and starting, I think there's a lot more. What would start being interesting for the local market to grow is if there is more research being done, more understanding of how these kind of food materials can help with the immunity and the protein level and the such. I think with more understanding of the local foods, or foreigners understanding more and wanting, there's a demand from outside, that would create a better story internally of how we can appreciate our biodiversity more. So I hope that helps.
Okay, thank you. I think that needs more attention around the world. So many countries, Vietnam, Thailand, many countries in Africa all have some local foods, of course, in China and Japan. So we'll come back to that. Let me also come back to the question of food technologies. So Professor Cole has mentioned the role of food technologies. I'm thinking I have a high respect for food technologists. They can do anything if the nutritionist can give them good advice what to do. But I'm thinking of Mr. Salim's comment that 95% of Indonesians are not eating good levels of fruits and vegetables. But of course, Indonesia grows a lot of fruits and vegetables, and they're available year-round. So maybe food technology has some solutions for that. Dried up mangoes. I don't think you can get dried durian to go very well, but dried mangoes or some salak or some other fruit could be workable. So we have some considerable expertise on that. Mr. Salim, like to start, and then maybe Dr. Prakash.
It got cut off a little as well. I think you're talking more on the drying, the transportation technologies, yeah. Or transportation.
All kinds of food processing technologies.
Yeah, I think you did mention one though. The dried durians is actually the dehydration process, which is actually starting to be a trend in. And I think the jackfruits are becoming a snack as well, and that will help with the transportation process. I agree with you. I think that if we can fix the cold chain distribution in Indonesia, I think more people would start be able to have access to the various foods. Because of the archipelagic position of Indonesia, we have to plant different fruits in different parts of the country. So if we can create a logistical flow and connection, I think that would really help with the expansion of eating more fruits.
Yeah.
Sorry.
Okay. When you look at model India, you have a 4,000 kilometer east-west, 4,000 kilometer north-south. The country is very big, and at this point of various problems, it is much better to have primary processing focus, which can extend the shelf life by a couple of days, maybe 4 or 5 days, and transport to not more than 300 kilometers, which will only require probably a cool chain rather than a cold chain at this point of time. So the productivity has to be well documented in terms of what moves and what doesn't move. So unnecessarily moving everything will create a glut. And therefore, it is vital how a commodity has been handled, like milk in India. The same model, the present government has translated it to other areas like fruits and vegetables, and at the same time meat, fish and poultry, which is much more localized, as well as the fish from the 8,000 kilometer coast. And all this has to be done from a database. And to really tell you the pride, India has to feed nearly 4 billion meals a day. Whether it is COVID or not COVID, it is 4 billion meals a day. And that much of movement of material did take place. And I don't think any of us or anybody in the country felt shortage of food. So there was a huge database that was managed. And I think that is very important when it comes to movement of food and variety and diversity. And the food habits will also change. After COVID, you will find a totally new food habits coming up in the new normal. So the industries have to really plan well, analyze the data today, and be ready for these innovative products for tomorrow. Because people have changed their habits and people will get adjusted to the new normal. So it is important to not only rest on traditional foods, but also on new foods that people demand as the COVID gets normalized into a much shallower cases as the vaccine comes in. Thank you.
Okay, thank you.
Jeff,
So,
Jeff, there are two questions, a couple of questions in the chat box that you might want to pick up, Jeff. Yeah.
I will take a look. ILSI, I think Professor Cole, you mentioned about the needs, the scientific agenda. ILSI is focused on science, so not on policy, even though we have some top policy experts speaking today. So let me ask a question about the interface. So we have hoped today to look a little bit at the science part of this. What science is needed to make progress on better, healthier diets, on better food technologies, on better information investment. Maybe Professor Cole, you could say something, and maybe Mr. Chow on those interfaces, because as far as I understand, the high-level experts, that is academics and scientific expertise and some policy expertise. How that the food supply chain, of course, is predominantly 90 or 95% in private hands, from small stakeholder farmers to big multinationals and traders. How to improve this interface between the two sectors to get better health outcomes for the world. I don't know who'd like to take that first. Maybe, Mr. Chow, talk about the Singapore experience. And
okay. That's I mean, maybe what we can share is that I think from a Singapore perspective, definitely the private sector will play a significant role when it comes to from food production all the way to basically the supply chain, entire supply chain. And the government essentially is to enable some of these processes to be in place. So how basically Singapore is viewing it in this perspective is really through the work streams that I've mentioned, the 5 work streams. Perhaps one aspect which definitely is a government's role, I feel, is maybe in the regulatory aspect. So when it comes to food processes, we are seeing an increasing affinity towards basically things like plant-based proteins and your milk protein from acellular agriculture, as well as the eggless eggs. So our view with regard to this is that I think these are exciting spaces or exciting things that are happening. And the role of the government then is really to look at it and ensure that these products are safe for consumption. So that's where, from Singapore's perspective, we are looking at it from a risk-based assessment. And essentially, we have put in place certain regulatory framework in order to assess some of these very novel kind of proteins or products that are coming on stream, and the consumers are really, due to the welfare issues, are actually increasingly basically open to some of these plant-based proteins. For example, the Impossible Burger. So we have actually approved Impossible Burger. We have assessed it and essentially think that it's safe, and hence we have allowed it to be marketed in Singapore. So these are aspects that we're keeping a close watch on, and essentially could potentially play a significant role in terms of our 30 by 30 being able to produce some of this for the purpose of Singapore consumers.
okay, I'm mildly curious. I wonder how many countries listening have approved Impossible Burgers. Don't necessarily get a plug for that, but that's very important. Professor Cole, maybe some brief comments?
Yeah, no, so I think, Melvin, what you're doing there in Singapore is absolutely fantastic. I mean, what needs to happen is a whole radical rethink around food security. You need to have government academia and industry working together around themes. I mean, that's what you're doing there. You know, you need the agronomist to be talking with the food scientists, with the nutritional people. You need the veterinarians talking to the human health people. You know, it really needs a whole new approach and policy around it. So what you're doing there is a fantastic example, almost rethinking, you know, the food security issue, putting, you know, not only putting kind of transdisciplinary expertise around it, but also I think we need to think about new business models of how we, I think the private sector has to be part of this solution. And so, you know, you know, the sorts of things you're doing there is absolutely fantastic. I mean, create the right models, the right business models for the private sector to play into that, but with the right policy, government policy, engagement of consumers. I mean, I think, you know, that's a fantastic example of how to move forward. So congratulations on what you're doing there. I've only seen a little bit of what you're doing, but it's just that's absolutely the way forward. Yeah.
Thank you. Thank you.
Thank you for that, because that leads to another critical question for investment. So there was some discussion about cold chain, but there are many new technologies that need investment. So everything from drones, precision agriculture, biotechnology, breeding technique. We talked about improving agriculture and just, you know, basic technology, blockchain. We don't have time to go into safety, but sometimes crises like COVID can impact a certain food supply chain where the food safety systems are, and you have to change to a new one and getting the food systems are there. So coming back to this issue of investment, investment is done again primarily by the private sector, but governments can play a role for investing in testing systems and regulation systems, and some aspects of the cold supply chain, the roads and those kinds of things. How can that be incentivized and prioritized in a target to improve public health? Professor Fan, Dr. Fan?
Yeah, I think we failed in policy, although I have been working on food policy for almost 40 years. We failed in policy in many aspects. One is currently the government policy is to provide financial support or subsidies to produce grains, staple foods, rice, wheat, and maize at the cost of fruits and vegetables. We can see, subsidies that can promote, empty calories. Well, obviously some calories needed. That policy must be changed. Right now, globally, we are spending $600 billion to $700 billion a year subsidizing all these major food crops. Can we use that money to help to support production of fruits, vegetables, and to develop the value chain for all these crops, because they are perishable? Beyond the cold chain, the whole infrastructure. I mean, this is a big issue. We've got to get this right. If we don't get it right, we will have no way to change our diet, to change our production towards also sustainability, towards better health and better nutrition.
Okay, thank you very much. And I don't want to forget to mention IFPRI published a book last year, of which you were the editor, on linking agriculture and nutrition. So in agriculture, usually they are rewarded by how many tons per hectare and what's the price. So they don't have an incentive generally to think about what are the nutritional aspects of the plants that they grow. We need to work on that dialogue and see how to do. And I think the food industry can play a role by demanding or requiring, setting up standards, for example, with nutritional requirements for agriculture. That might be a link to do that. The last thing, we're going to have to wrap up soon. So I'll give you one last question with final thoughts. There's a lot of discussion these days about so-called optimal diets and what is the best food for the world, and some people have designed some systems. A lot of that work has been done in a primarily Western context. There have been some questions raised about the pricing. how many people, maybe one example was a diet that's been proposed, but a later analysis showed about 25% of the world's population couldn't afford it. And then questions about availability. So olive oil, we all know olive oil is good, but there are not enough olive trees in the world to supply the whole world, and we don't eat olive oil much in Asia. But in Asia, we have a long history of diets that certainly our dietary patterns are different compared to Europe and North America and even South America. And we have a lot of diets that we think healthy. We have famous Japanese and Chinese and Indian, Indonesian, Thai diets that we think have healthy aspects. How can we work towards encouraging healthier diets in an Asian context and making those available to people at affordable prices? So that has to be the last question. I open it to the panel. Who would like to start?
Yeah.
Okay, Dr. Prakash.
Okay, I think the diet is important from a tradition point of view. Also, what people have been eating in the COVID times, there is a kind of hesitant among the people are hesitant to try new foods. So therefore, because they are used to certain foods, and the food-based approach to nutrition has become more important than ever before I have seen. It's always, we have to emphasize food-based approach always. But today, it is automatically emerging in and bringing in the traditional foods back into the system, because people have been clearly told that a food-based approach is much more sustainable. But of course, there are clinical cases where I have to give mega doses of vitamin D, etc. That is a different situation. But I think for a normal, healthy individual to continue his immunity, fighting through the immunity and multiplying, boosting the immunity by 4 times, 5 times, the traditional foods have been a fantastic storehouse. And I think there is a shift in Asia, especially. And the industry, I would say, has not taken advantage of this. So therefore, the same products are coming from the same companies even today. So we require to have a paradigm shift in the industry houses to look at the demand and supply of traditional foods which are almost ready to eat. So that's because otherwise traditional foods are very complex to make sometimes. So I think there is an opportunity that is there, which industry has to put in innovation with academia and bring it into the system, so that the food-based approach to nutrition, I think the nutritional remedies for the various maladies is one thing that the industry should not miss today. And these products are missing on the shelf. These products are very badly needed, and I think it's an opportunity. And it's not going to be ending up in 2 months, 3 months. It's going to be there for a couple of years, and that will be the future area of investment for industry. Thank you.
Okay, thank you, Dr. Prakash. So ask Mr. Chow. So Singapore is a little bit different. We're quite diversified in our eating. I had Indian breakfast this morning, a Chinese lunch, and I'll have Western for dinner. So I don't know exactly what our food pattern. Mine may not be typical, but what's the Singapore perspective? Food for the future.
Okay. My personal perspective is really, when it comes to optimal diets, it's really dependent on every individual. I mean, even from what is in the West versus what's in the East, it might be very different. But however, I think from a role of government, I think it's important to take care of our people. And when we say take care of our people, then essentially, given Singapore's context, we are trending, or tendency of going into diabetes is becoming an increasing trend. So I guess from a government perspective, that's where we are tackling the sugar issue, and hence putting in place measures to address this diabetes issue, which will actually be a serious concern. And that's where my sister agency, the Health Promotion Board, is actually looking at some of these very seriously, in order to tackle it from basically Singapore's perspective and the citizens' perspective, given that the trend is an increasing issue of diabetes. That being said, I think there are other aspects of advocating a healthy diet, to the extent that we have this healthy plate, which is basically through public education, going through the schools, you're supposed to have half of your plate filled with vegetables, or 1/4 of it with carbohydrates, and 1/4 of it with proteins. So these are some efforts that we are putting in place to basically promote good eating habits. What is the proportion at which you should be covering, but at the same time addressing some really key critical contents that may impact the citizenry, especially when it comes to this more chronic kind of diseases, and having even regulatory measures in place in order to encourage basically the Singapore industry, F&B industry, to have less sugar in their drinks and things like that. So I think these are some of the measures that we, from the government, what we have put in place to tackle the different issues.
Okay, thank you so much. So, Mr. Talim, Indonesia, let me think, 5th biggest country in the world, and a lot of things happening, and you have, again, a unique perspective from the scaling up nutrition aspect. So both industry, you can't speak, of course, for the whole industry, but an industry leader, but also connected to public health. So how it can tackle.
Thank you. I think in terms of the healthier diets, I think how we can encourage people to be in healthy diets, I think it goes back to the familiarity of the products. Like, you cannot start introducing them something or a concept that they will not be familiar with. It should start with the current diet and how you can say either additional or reduction. Like, as I think Mr. Chow's point on the healthy plate, I think that's a concept that I think Indonesian government tried to use. One of the methods that we are trying to use as well, like the half, quarter concept. So the familiarity, it needs to start with the local food menu, and also as well. And social and the geography as well. Every region would have different kinds of local foods that you can start with. Then another side of it is also helping people to understand the local products like tempehs and tofus can be a good addition to the menu, and it's very readily available in the wet markets, in the supermarkets, and it should start with very easy access to these foods. I tried the whole vegan lifestyle for a week, and then it's just not for me. It's really not for me. So it really needs to be something familiar. How can we improve the current diets? I mean, for maybe just a quick example is, if we have rendang in Indonesia, how can you actually create a rendang with similar flavor and essence, but of a healthier option? Like I think Mr. Chow, the Singapore Health Board, I think, is doing a very good job in creating alternatives to such the local menus, so that the locals can understand how to choose the more healthy options. And I think the governments, and one more last thing is, I think the governments need to start helping to explain. I think in Indonesia we have the AKG, which is the minimum number of maybe the vitamins and the minerals that a body needs. I think, how can we explain that in a better, easier context for people to understand? So I hope that's my last, just very scattered thoughts on the food diets.
That's very helpful. So President Jokowi has been very active on the stunting issue in Indonesia, and he's worked together with the World Bank to really tackle that. So there's a lot of focus in Indonesia to improve that. So thank you for that. Professor Fan, China has a special place in the world, the biggest country. Chinese food is available all over the world. My good friend in Uganda always takes me to his favorite Chinese restaurant. But thinking of what does that optimal diet mean? How can we make progress?
Yeah, but there is no Chinese food. There are so many different Chinese foods.
Yes, of course.
Style, Beijing, Shandong, Jiangsu, Shanghai.
Very different.
I think another local delicacies. But the question is, how can we really develop the local traditional sort of courses, let's say, for Beijing style, for Shanghai style, for Sichuan style? This is very critical. Some of the local delicacies is not healthy, not sugar, and not so oil, and not so stir-fried. So while we are keeping good traditions, good taste, good flavor, how can we make sure that the ingredients they use, the way they cook, will preserve nutrition, will make sure that we're not going to go overweight and obese. We can do that. I mean, local sort of dietary guidelines must be developed for big countries like China, obviously India, Indonesia, and beyond.
Thank you very much. And Professor Cole, we'll wrap up with you. Australia has a very special role, a very big agricultural country with population not in the top 5, a little bit on the smaller side, but you certainly have a global perspective. What is this?
Thanks, Jeff. I mean, well, look, I would say, I think, look, around the world, I think we've failed miserably as a policy of changing behaviour through dietary guidelines. I think we have to admit we failed miserably around the world in dietary guidelines. Everybody knows what we should be eating, but we're not eating that. So we have to be, as Shing and Fan has said there, we have to be more creative. We've got the science now where we've got nutrition now coming into a much more harder evidence-based, so we can actually now, do the feedback loop. You can actually you've got the science for the basis of personalized nutrition. You're going to have biomarkers in that space as well. But so we've got to be thinking about making foods that are traditional but are convenient. We've got to make them healthier, more nutrient dense. We've got to think of new ways of presenting, preserving fresh fruit and vegetables so it is convenient and more available for folks. But finally, let's not forget, the great pleasure that we get from eating food. Okay, this is a great cultural and societal thing. So let's eat healthier, but let's not forget that food is one of our great pleasures. And so we have to be, when you go to different parts of the world and you get to taste, different cultural norms of food, that's one of the biggest pleasures you get when you share your culture and you share your food with other people. And let's not lose sight of the great pleasure that food can be, but let's try and make it healthier. Thanks.
Thank you, Professor Cole. That's a really marvelous note to end on. I want to thank the speakers and the panelists. It's been a really magnificent session. I think we've covered a lot of ground. We can see a lot of future areas for discussion. I would remind the people who are listening in that this is the second in our series on COVID and the food supply and the future of food. Our first session is available as recording. You can find that on the ILSI website, and we've submitted a paper based on that earlier webinar. So that will be hopefully coming out a bit later in the year. I think I won't try to wrap up. We have a recording of this session will be made available, and we'll discuss if we do something to write it up more formally. But I think a lot of really good and important information, good directions for the future, and making a healthier planet. And as Professor Cole suggested, we don't forget what a great joy it is to eat wonderful food every day.
I think we have overrun the time. Thank you very much. I think it was an excellent discussion. A lot of food for thoughts for us to write up what we learned from this, and we will send out a summary to everybody. Thank you very much for joining us for this second session, and appreciate all the effort as well as your thoughts. So, good day, and to all our participants,
Thank you.
please give us a little bit of your feedback.
Thank you.
Bye-bye. Yeah.
Bye-bye.
Thank you.
Thank you.